You suspect you're out of sync. Thinks that you're out of your mind. Everything you know is wrong.
In April of this year, the American Psychiatric Association will release the DSM-5, the newest so-called diagnostic Bible of mental disorders. However, while this manual is supposed to help doctors properly diagnose and treat patients with mental disorders, it may be doing more harm than good. In fact, the DSM-5 may just be a ploy by Big Pharma to increase its already astronomical profits. So if you think that the American Psychiatric Association and the DSM-5 are looking out for the best interests of you, the patient, then everything you know is wrong. Joining me now is Dr. Bruce E. Levine, a clinical psychologist and author of Get Up, Stand Up, Uniting Populists, Energizing the Defeated, and Battling the Corporate Elite. Dr. Levine, welcome to the program.
Good to be on.
Am I pronouncing your last name right?
Yes.
Oh, good, thank you. What exactly is the DSM-5?
The DSM-5 is a publication by the American Psychiatric Association, which is the professional group of American psychiatrists, which really is the diagnostic Bible for mental health professionals, psychiatrists, psychologists, and other mental health professionals. And the first one came out in 1952, and it wasn't that big a deal, but when third-party payments, insurance companies, and then ultimately in the last 20 years, when drug treatments became big money, the DSM became a much more significant entity because it's the gateway to treatment. So the more that you can give people different diagnoses, the more there's a greater business for psychiatrists, but even bigger business for pharmaceutical companies.
Back in the 80s and 90s, I wrote several books on attention deficit disorder, and I noticed over time, as new drugs came out that were being used to treat ADD and then ADHD, that the DSM actually changed. You know, they had the 4 and then 4 revised. Actually, I think it started with 3 back then. But to what extent is the drug industry driving the DSM as opposed to the other way around?
Well, there's two forces that are going to make a lot more money. The more people are diagnosed, the more normal aspects of our human behavior are pathologized. One, certainly our mental health professionals, psychiatrists, psychologists, but the big money is to be made by pharmaceutical companies. So, for example, in the DSM-5 that's coming out, it turns out that a lot of even establishment psychiatrists are upset with the idea that grief is now going to become pathologized. So in the old DSMs, the DSM-4, there was what we call the bereavement exclusion. So in other words, if you suffered symptoms of depression for a couple of weeks after a loved one died, people said, well, this was normal. We should not diagnose this with depression and give people Prozac, Paxil, and antidepressants. Now, in the DSM-5, that bereavement exclusion is being taken out, and so if you go through a normal grief reaction, you're going to get diagnosed with depression. And so now virtually all of us will be mentally ill, is what it comes down to. If you suffer any grief in your life and you go through some symptoms of depression, you're going to be labeled as mentally ill.
What is the political and economic relationship between the American Psychiatric Association and the pharmaceutical industry?
Well, for many years, they've taken large amounts of money, the American Psychiatric Association, from drug companies. I mean, the American psychiatry was in big trouble in the 1960s, 1970s. You might remember One Flew Over the Cuckoo's Nest came out in 1976, and it was there were a lot of competition from a lot of other different professions, and people laughed at, justifiably, the validity and reliability of diagnoses, psychiatry's ability to even reliably diagnose anyone, their ability to treat people better than sugar pills. And what happened was psychiatry said, well, we may go out of business unless we get some big money behind us. And so there was a big battle in psychiatry among folks who didn't want to do this, and folks said, we're going to go out of business as an institution unless we get some big money supporting us. And that's when Big Pharma, you know, it was a marriage made in heaven or in hell for people like me, that Big Pharma started to support not only the American Psychiatric Association, but psychiatry departments, so-called thought leaders, anybody out there who's willing to kind of push a new diagnosis. So, you know, you have things, for example, today like pediatric bipolar disorder, labeling 3-year-olds with bipolar, which most of us would, if you took a look at the symptoms of bipolar, of mania, you'd say, well, these are pretty normal for a 3-year-old to feel grandiose, to be very moody, all these things. But if you push, you get some famous psychiatrists at Harvard, which pharmaceutical companies did, who pushed this pediatric pediatric bipolar disorder, give them a few $1,000,000. This was investigated by Congress a few years ago. You can create almost anything with big money in the United States of America, including normalizing, pathologizing very normal behavior.
Yeah. We are all mentally ill now, I guess, according to the drug industry. Dr. Bruce E. Levine, thank you very much for being with us tonight.
Sure, great to be on.
And now everything you know about the diagnosis of mental illness is right.